Hello, my name is Leslie Copeland and I'm a senior at Southwest Christian University. I would like to talk to you about current mental health policies connected with insurance, fairness in the workplace, patients' rights in long-term facilities, and laws regarding discrimination. I would also like to discuss how we can advocate for mental health. According to the Affordable Care Act, or some of you may know it, Obamacare, health plans that are offered by employers with more than 50 workers will be required to treat mental health benefits the same way they handle coverage for physical ailments. Now, what this means is that there will be no separate annual deductibles for mental health treatment, no co-payments for visiting a psychiatrist or a social worker. Although the ACA has made mental health treatment more affordable in some aspects, it is still not accessible for everyone. Now, this is because some states have the option to not expand Medicaid to cover the gap between private insurance and Medicaid, which makes it difficult for some to access mental health treatment. Now I would like to talk about the fairness in the workplace. Under the Americans with Disability Act and mental illness, your employer must make every reasonable accommodations if they know about a mental illness. It is your duty to let your employer know any conditions or concerns that you have. If you are having a hard time doing your job, just ask your employer about what they can do to make it better for you. Also, if you're going for an interview on a job, an employer cannot ask you about your medical or psychiatric history. And if you are suffering with a severe illness, your employer must provide self-paced workloads and flexible hours. They must also modify your work responsibilities and allow paid or unpaid leave during any times or periods of hospitalization. Now let's talk about patients' rights in long-term facilities. According to the National Alliance on Mental Health, every patient has a right to receive humane treatment with dignity, right to refuse treatment, the right to understand the risks, benefits, and alternatives to a particular type of treatment, the right to confidentiality, the right to receive mail, make telephone calls, the right to safety, sanitary conditions, well-balanced meals, and an interpreter. They also have the right to an advocate and must be informed of the rights to file complaints and grievance. When it comes to discrimination, the U.S. Department of Health and Human Services promotes and ensures that all people have equal access to and opportunity to participate in certain health care and human service programs without facing unlawful discrimination. There are certain issues and concerns within the mental health field. First thing is that there are a lack of mental health services in a lot of areas. The cost of mental health care can be unaffordable to many people, and health insurance may only include partial payment for psychiatric treatment or none at all. The quality of care and the living conditions in mental health hospitals may be poor, leading to human rights violations. Regulations and checks concerning involuntary admission and treatment usually are lacking, and this is often associated with loss of liberty. So, we're thinking, what can we do to advocate to get the word out there? What we can do is develop a mental health legislative caucus, which includes a group of legislators organized to help the mental ill. Now, what they can do is find funding for programs, find funding for programs, and educate consumers about mental health illnesses. What we can also do is develop a public announcement campaign which addresses the awareness of mental health. And a third thing we can do is develop an agency that would oversee and enforce the implementations of mental health issues and will make it sure, and this agency will include professionals from the mental health field and individuals who have or are receiving mental health services, religious leaders, political figures, and law enforcement.